Good evening, friends. Good evening, sir. Good evening, ma'am.
Good evening.
Good evening.
Good evening, Dr. Asrani.
Good evening,
Welcome to the,
Satish.
good evening, sir. Welcome to the 41st webinar.
That is quite an achievement, Dr.
Quite
Asrani.
achievement. Yes, ma'am. 2 words from you, ma'am. Then I'll start.
Yes. Good evening, Rajani and everyone else.
Good evening, all participants. Thanks for taking out time.
Shall we start, ma'am?
Yes, please.
Okay. Let me share my screen. Is my screen visible?
Yes.
Yeah, visible.
Thank you, sir. Friends, I have been told to introduce the 2 legends of NJH and who are my mentors too. It is like सूरज को रोशनी दिखाना. But still, since the job has been given, I have to do the job. Sir, first of all, congratulations to complete 46 years of your clinical practice. I know, I'm certain that many of the participants would not have been born also. And at that time, I was 5 years old. And today you are my mentor. Apart from his clinical practice, sir is also into insurance risk management and has pioneered medical audit in insurance in India. He is known in the insurance industry in India as well as abroad. With over 500 presentations in insurance risk management, sir has held talks across Dubai, Bangkok, Kuala Lumpur, and Singapore. He's also one of the first medico entrepreneur to devise cloud-based fraud prevention solutions for insurance companies in India. Ma'am, she has been practicing classical homeopathy since 49 years. And I mean, I don't have the words to tell about her. You all know. And she has her own practice at 4 places in Mumbai. And she also visits Adivasi Charitable Trust at Palghar. I would add one thing, that sir is the brain of NJH, while ma'am is the heart of NJH. So, sir, please start. Thank you, sir. Please start the webinar, and as usual, अपने आगोश में ले लीजिए.
That's all.
So, welcome, friends. I'll start the topic of today that I have taken. The genesis of this webinar, for those who attended the last roundtable, there we were discussing occupational health hazards, and one of the trigger was stress. And I said stress causes so much problems that we need a webinar on that, and I volunteered, and then I forced Dr. Vishpala to present cases. So as a practitioner, what is the minimum that we must know stress about? See, it's very easy to say stress causes blood pressure. Stress causes diabetes. But do we know why it causes and how it causes and what actually is stress? Because if any of you plans to train a patient into stress management, believe me, you need to be able to explain to them what is stress and why it occurs. That's me. So what we must know about the minimum. I have spoken to a corporate seminar, stress for 4 hours. This is just 45 minutes. So what is the minimum that we must know about? Everyone loves desserts. Very few people do not love desserts. It's like universal. And when you spell this backwards, it is stressed. So everyone is stressed. It is universal. In early 70s, from the time many of you were not born, there was a book by Alvin Toffler, Future Shock. This book described American sociologist predicted that rate of change in modern civilization would accelerate to such a degree that enormous numbers of people would experience shattering stress and disorientation. Today, we all know that technology has developed much more than our human brain has developed. And this was predicted way back in 1970. Toffler described this condition as future shock. So what are the factors that have drawn attention to stress in the future time, in the modern times? Human biological evolution is lagging behind development in technology and lifestyle. Today, if you have a grandchild in the house who's 5-year-old and you buy a new iPhone or any Android phone, that child can master it faster than you can master. Physiological and psychological stress emerges as a result of growing deficit between daily demand and coping resources. I'll be talking ahead. If I have to describe stress in one line, it is inability to cope. I am practicing in my clinic. You are practicing in your clinic. And you have to leave for a very urgent wedding that you must attend. And knowing your practice schedule, you knew you will be able to leave at 7 o'clock. But today, 4 patients have come for follow-up in emergency. And as a doctor, you cannot say that I will not see you. They are your patients. Now, the inability to reach there on time, where people are going to wait for you for the ceremony to begin, that gives stress because now I cannot cope. TAT is a word which is in corporate word, turnaround time. So today, all of you must have seen a patient sends you a report at 4:27 p.m. and at 4:30 p.m. they will call you, Doc, I sent you the report and the report has 14 pages which you have to see on your mobile. They want responses faster. When I started practice 46 years ago, I had no laboratory in my area. People had to travel from Santa Cruz East to Santa Cruz West. And the CBC report took 36 hours. So on day 2, if the patient asks me, Doc, what is the fever about? I'll say, appears viral. Let us do a test. I'll send him for CBC. I had 36 hours to arrive at a diagnosis. And if CBC was not contributory, I'll ask for Vidal, another 36 hours. Today, your patient wants the answer on day 1. And today your patient wants instant cure. Today I lost my head on a patient, my very regular patient. I gave her medicine at 3 o'clock for a cold and sore throat. At 6, she calls me, Doc, it's worsening, give me an antibiotic. So our turnaround time of responding to patients or making sure a diagnosis or results come faster is giving us stress that we do not realize. Research has shown that 70 to 80% of all diseases and illnesses are stress related. This a homeopath knows better than me because you spend so much time on mental rubrics. It has also shown a relationship between lifestyle and stress related. So stress management requires lifestyle management. Define stress. Webster's dictionary says it's inability to cope. A stress is being forced to accept unwanted change. I am a smoker. I hate somebody telling me, give up. But today when I went to my dentist and he said there is a leukoplakia which we need to do biopsy, I am forced to stop. I have no shortage of money. I am very comfortable. But now I am stressed because I am forced to accept this change. Stress is a symptom, not a disease. What is stress? Any demand, physical or mental, that is placed on your body, which you cannot cope up with, is stress. During COVID time, a lot of people, including doctors, went through major stress because income suddenly stopped. EMIs did not. Salaries did not. Stress. I have less income, my expenses are more. It's a state of anxiety produced when events and responsibilities exceed one's coping capability. I told you, inability to cope. Major life changes. Loss of a spouse, loss of a child. Subsequently, stress develops. And daily hassles. I travel from Virar to Churchgate every day for job. And 3 days in a week, I am late and I have to listen to my boss. These are my daily hassles. Nothing major. I work overtime, I fill in the time, but then that look I get gives me stress. Stress is personal. What will stress somebody may not stress others. A boss shouting at one employee is stress to that employee, not to other employees. People who have lost near and dear ones in bomb blasts, for them, traveling through local train is a stress. Children who were traveling by train or people who were traveling by train, the day the bomb blast news came, families were stressed till they reached home. Let me compare stress with the tent. What is tent? Tent is nothing but 4 big nails put in the ground, a piece of cloth and 4 ropes. When you take these ropes and put sufficient stress on them, a pull or stress on them, this useless piece of cloth becomes a useful tent. So this will tell us that stress is important for our life. We cannot survive without stress. Stress leads to better performance. We'll see it as we go ahead. Stress is dangerous when unduly prolonged. It lasts for a longer time. Comes too often. A girl gets into an elevator on 21st floor of a building. It's 7:30 p.m. Offices are shut. At the same time, a colleague of hers enters the lift. They don't talk to each other. The girl is worried that he may try to molest her. So she is ready to fight back. Poor fellow does nothing. The same thing repeats for 20 days. The girl on 21st day also is prepared to fight. And on 22nd day, she visits a doctor with a neck pain. Because when you keep your body braced for 2 minutes, 3 minutes every evening, prepared to fight, your neck muscles go into spasm. Concentrate on a specific organ of the body. I just give an example. People working in advertising industry or today anyone, because the turnaround time is there, I have to deliver this today. They start getting hyperacidity because stress is focusing on the stomach. How do you diagnose stress? Not by what it is caused by, but what it causes, the symptoms of stress. I'll give you 3 scenarios. You are walking in your lane of the house at midnight, and the single light in that lane is somehow gone off. You are walking, it's your own area, you're not scared. But then you start hearing footsteps behind you. The footsteps are keeping pace with you. You stop, the footsteps stop. You will start feeling a funny feeling in the pit of the stomach, epigastrium. You will start getting palpitations. You will have some sweat on your forehead, and your breathing becomes shallow. Scenario 2. You have sent a patient to the hospital, or you treated a patient yesterday for chest pain. You said it's acidity, and the patient died in the night. Next morning, the family calls you that, doc, we want to come and talk to you about what happened to our family member. Till they come, you will start getting palpitations, a funny feeling in the stomach, little shallow breathing. You don't know. Are they coming to threaten you? Are they coming to break the clinic? Are they going to accuse you in front of other patients? Instance 3. A person is said, boss wants you now, and he's angry. And this guy is waiting outside the boss's office. And there is a talk in the office that a lot of people are going to be terminated. He gets the same symptoms: emptiness in the pit of the stomach, palpitations, sweat on the forehead, and little shallow breathing. All of them have stress. The causes are different. The symptoms are same. Why does stress occur? Commonly, frustration, irritability or anger, feeling stress or overwhelmed. Overwhelmed, inability to cope. Anxiety, worry or fear, not achieving target. Those of you who are on LinkedIn must have heard, or it came in Times of India also, or other newspapers. One HDFC bank senior manager was suspended because he threatened everyone that you should get 75 life insurance policies every day. Everybody must be stressed. Restlessness or agitation for whatever reason. Feeling helpless. Work from home. A lot of people don't like work from home. So if I have to describe how does our body react in terms of stress, it's called fight or flight phenomenon. The 3 scenarios that I described you, alone in a road with footsteps behind you, You had two options, run or turn back and fight with whoever is there if they are a threat. Same thing, waiting in the office, might as well go away and not bother. Or when the family calls you, doc, we want to come and meet, I would say, oh, I'm not in the clinic today because it's a mobile call. Or you will say, I'm coming to your side, I will meet you at your house. So whatever happens, happens away from your practice. So it's fight or flight. It's the body's physiological reaction that prepares us for swift reaction. The girl in the lift was preparing for swift reaction, but she was in an elevator. She could not run. So she was preparing herself to fight. A survival instinct to fight or run. And whatever you do, fight or run, you require energy. This is meant for physical stresses, but also happens for mental and emotional stresses. Both for a real threat, a car accident, or a perceived threat, noise at night behind you. Two emotions specially associated with stress are anger and fear. Anger produces urge to fight. Fear produces urge to run. And people who are angry but do not talk, again, get into stress. The stress response occurs in proportion to perceived danger. After all, we understand what is the danger, so we will have a relatively same response. When not used, stress products can build up. There are stress chemicals. If you don't use them, they build up. Over time, this buildup can be unhealthy. I'll give an example here. All of you must have driven either a two-wheeler or a four-wheeler. So, I'm not talking of automatic cars, but in earlier cars, you had to, after shifting into a gear, you have to release the clutch and give accelerator. Now, when we were all learning driving, it would happen that we give accelerator, but we do not release the clutch. We would get an angry whine from the engine. That is stress chemicals not being used. Every time you do that, no, you damage your engine. So if you do not react to stress, you neither run or fight. Fight means even talk or share, then that causes problem over the term. This animation has taken me a lot of time to prepare. Some of you may have seen it in other webinars. This is our human body. And this is the heart, which is very comfortably beating at 80 beats per minute. And when we are stressed, this goes down to 120, 130, 140. But it can again come back. We have a blood pressure which is at 120, 80. But again, when we are stressed, this goes up. Blood glucose goes up because if I am running or if I am fighting, I need sugar levels. My muscles, if they have to exercise either for running or for fighting, they need glucose. Then we have hyperglycemia and stress. And then because we are bracing ourselves, it's like a person standing at the beginning of a race, get set. Your muscles start paining, the girl in the elevator. Your breathing becomes shallow. And the feeling in the stomach is when energy is being used all over here, heart rate, blood pressure, sugar, muscles, there is less energy to digest food. The stomach movements slow down, and that gives us a feeling of emptiness in the pit of the stomach. And along with that, fear. Will I be able to run? Will I be able to fight? Now, if all of this continues and the person neither runs nor fights, then you have manifestations of stress, blood hypertension, resting tachycardia, hyperglycemia, prediabetes, diabetes, musculoskeletal pains, breathlessness, and inherent fear. This, my dear friend, is the stress reactivity. Body produces stress chemicals, and these stress chemicals produce stress reactivity, increase heart rate, increase blood pressure, increase breathing, vasodilation of arteries to body's periphery, arm and legs, cold extremities, perspiration on the forehead, increase blood glucose levels. All these are manifestations of stress. The likelihood of ill effects developing from built-up stress product is dependent on two factors: duration, the amount of time our body's physiology varies from baseline. So if I get tachycardia due to stress once in a day for 1 hour, I will have symptoms faster than if it happens once in a week for 1 hour. Degree, the amount of physiological variance from body's baseline. If my blood sugar is 74 fasting, and now with this, I'm perpetually in stress, my sugars will remain high for a longer period. I'm more likely to become pre-diabetic. Of the two, duration is more important. Now, this slide is going to explain to you about how stress chemicals develop. Please pay attention. We have a brain and there is a stimulus for stress. Somebody calls you, says, your son comes from Churchgate, no? Yes, what happened? Today, 3 trains, there was bomb blast. This stimulus, within split second, hits the cerebral cortex. From there, a message goes through reticular activating system to the hypothalamus. The stimulus directly also stimulates hypothalamus. This hypothalamus, through corticon releasing factor and through thyrotropin releasing factor, works on the pituitary. And this hypothalamus, through sympathetic nervous system, works on the adrenals. Pituitary also stimulates the adrenals by ACTH, and pituitary also stimulates the thyroid by TTH. Thyroid produces thyroxine. Thyroxine, excess of thyroxine gives palpitations, gives tachycardia, gives weight loss, causes physiological arousal. All the symptoms of hyperthyroidism are physiological arousal. Adrenal is more harmful. It produces cortisol, aldosterone, epinephrine or adrenaline, and norepinephrine. And dear friends, these 4 are stress chemicals along with thyroxine 5. Now you know why physiological arousal occurs. All the slide I showed you, tachycardia, hypertension, that is physiological arousal. So and all this, takes maybe 10 seconds, not even more than that. Symptoms of stress. Hypothalamus activates adrenal glands, as we saw last slide, to release adrenaline and cortisol into circulation. This adrenaline and cortisol, this hypothalamus also stimulates adrenal gland to secrete more adrenaline. There is more adrenaline in circulation. Blood supply to muscles increase, vasodilation. Sweat glands produce more sweat, cooling of the body. Heart rate increases, tachycardia. Rate of breathing increases, shortness of breath, and pupils dilate. So now I hope you follow. Adrenaline is the culprit for all my physiological arousal. Effects associated with stress response. 3 stages: immediate effect of stress, intermediate effect, and prolonged effect. Immediate sympathetic nervous system response. Epinephrine, norepinephrine related, adrenaline, noradrenaline. Time is 2 to 3 seconds. It's like a phone call. Intermediate effects are adrenal response. Epinephrine, norepinephrine again released from adrenal medulla. Time 20 to 30 seconds. It's like an email. And prolonged effects, ACTH, vasopressin, and thyroxine effect, various metabolic processes. Time, minutes, hours, days, or weeks. It's like your overnight prime delivery. Again, repeating, in immediate, intermediate, and prolonged. All this together cause a patient to get symptoms of stress. Conclusion: stress reactivity originates in the brain. Once stimulated by thalamus, the hypothalamus activates endocrine system. I'm just repeating the same. And sympathetic nervous system pathways. The hormones from the endocrine system and nerves from the sympathetic nervous system drastically alter the body's normal physiology. We have shown you all that in that animation. The net result is body is prepared to either run or fight, and when does not do anything, the stress products build up. So what causes stress? What diseases are caused by stress? High blood pressure, diabetes, both of them leading to stroke and heart attack. Ulcers. Most of the senior executives who have deadline issues have hyperacidity and ulcers without taking spicy food, alcohol, or smoking. Migraine headaches, tension headaches, both have a background of stress. Allergies, asthma. There are patients who get acute asthma, exacerbation of asthma when they are stressed. There are people who get hives, who get urticaria because they are stressed. Rheumatoid arthritis also gives exacerbation when stressed. Backache. You must be having a lot of patients of low back pain, no leukorrhea, X-ray normal, MRI normal, clinical examination normal. You have to find out what is causing it. That girl in the elevator, when she goes to a doctor with neck pain, will have to go through X-rays, MRIs, and nobody will think it could be stress. Cancer, yes, stress causes cancer also. One of the factors. And last but not the least, depression and anxiety. Who are the people more at risk? Now, we all know our patients. I may be spending 5 minutes per patient, you spend 1 hour. Type A personality is more at risk. Who's type A personality? Excessive competitive drive. I cannot lose. I must win always. Very aggressive. Very impatient. Can't sit still. sense of time urgency. It has to be done now. What is going on? Free floating, well rationalized hostility. Everybody is against me. Everybody wants me to fail. And deep-seated insecurity. Will I succeed? Will I not succeed? If I teach other doctors, then my competitor will learn from it and he may practice better than me. These are also known as hot reactors, people who overreact to stressful situations. Symptoms of hot reactors include feeling anger very easily, often becoming anxious or depressed, frequent urination despite a prostate problem or a urinary tract infection, experiencing constipation or diarrhea more often than usual, experiencing nausea or vomiting without any GI causes. So 3 types of stress: eustress, that is good stress; neutral, no stress; and distress. Distress is what should worry us. Neutral, no stress. This person is bored. He's yawning all the time. He's sitting. He has no worries in the world. Eustress is the stress you feel when the roller coaster is coming down. It motivates, it excites, it energizes. It is the stress of winning. Accelerating experiences. So, just before going in the exam hall, when students are walking around, pacing, reading, talking, muttering to themselves, they are motivating themselves. That is eustress. They have to go in and perform the best. Type of stress you are likely to experience when you receive an unexpected promotion or reward, or a patient's family coming to you with sweets. Doctor, we were suffering for 5 years. You put us right. That is eustress. It happens before performance, stress of winning and achieving, or trying to win. Those of you who are seeing Kaun Banega Crorepati when it comes, you will see that before Mr. Bachchan walks on the stage, behind the curtain, he's pacing. He's moving his hands like this. He's trying to motivate himself. Distress is negative stress, crushes, oppresses, unusual events carried beyond rational limits. Negative stress results from losing, failing, not being able to cope. All wonderful mental rubrics for you all. Distress affects people in a harmful way. Turnaround time is the worst. Then, all these people who are stressed, they get automatic thoughts. There is an event. 3 trains have had bomb blasts. It's an event. The thought that will come will not be that, I'm sure my son was not in that. There'll be a negative thought only. And that feelings, physiological arousals, emotions, stress, everything. And this is automatic. You don't have to try for that. Automatic thoughts are often negative, always appear instantly within seconds. Thalamus response. They're almost believed despite being illogical. Often the thought will have words like should, ought, must, not that is. The persistent, self-perpetuating till the bell rings or the son picks up the phone. And habitual themes are repeated. Bad news, they are learned. Automatic thoughts are learned. For a positive thought, you have to make an effort. Negative thought is automatic. How do you manage stress? Decreasing stressful behavior. We have to decrease our behavior that we should not react to stress. Accept that you are stressed. Do not be a macho. Me and stress? Oh, forget it. No, I am stressed. See, just imagine in our family practice, we see patient after patient. So if one patient has angered me, I have to cool down before I go into the next cabin and look at another patient. So if I accept I'm stressed, I can work towards controlling it. Identify what behaviors to change, lifestyle or health behavior, which one? Identify barriers that prevent behavior change. I know I must go for a walk, but I have no time. So what do I do about time? How to deal with stress? Exercise, nutrition, relaxation techniques, meditation, time management. Biggest thing. If you want to do more in life, if you want to practice, if you want to update yourself, if you want to attend webinars, then my dear, you need to manage your time well. Communication skills. Most of the stress comes from giving wrong message to anyone. You may not mean it, but if you're making the other person stressed, or if you don't understand what is told to you, then your communication skills are very poor. Change your behavior, control your anger. Today, a patient came to me with temporomandibular joint pain from village. He had gone through an MRI also. My first question was, do you get angry? And all his accompanied people, they started laughing. They laughed that now he's caught. So that behavior needs to change. Change your environment if possible, because every time it's not possible. Create social support. Everyone should have friends and family. We doctors lack in friends. Our only friends are doctors who only talk of patients, or there are patients. Family members we have no time for. Remember, sometimes accepting what you cannot change can also relieve stress. Exercise burns stress chemicals. Exercise is the best thing to burn stress chemicals. Aerobic exercise 5 times per week. It includes walking, running, jogging, cycling, and swimming. 10 to 15 minutes of stretches, free hand exercises or weights. Sustain the activity for a minimum 20 to 30 minutes. Set small attainable goals for yourself in exercise. If I start exercising now, I have not exercised 4 years. I'll say, oh, I must lose 5 kilos this week, this month. No, it's not attainable. And if you are working from home, then spot exercises. One place, spot marching, 40 minutes. Nutrition, keep caffeine intake to a minimum. Move to green tea if possible. Eat lesser high fat and high sugar foods. Timely meals. Quit smoking. Moderate alcohol intake if at all. Increase fiber, B complex, vitamins and vitamin C. It is a 3-legged stool. Exercise, nutrition, and time management is not the third leg. Third leg is relaxation. Time management, wake up early before the alarm goes off. Make a list of things to do each morning. Prioritize daily activities. What is important today? If you're going to clinic, what is the time work that I must do before I start seeing my patients? Reduce screen time. Mobile, WhatsApp, YouTubes. Take a book or other reference material when you know you have to wait. Especially if you are working on a repertory on a computer and your system is down, you don't want to waste that time. Use spare time for other tasks. Time management, I'll not spend much time because doctors are good. Practice anger control. Remember the golden rule. Count to 10 before speaking in anger. Never send a WhatsApp message or a text message or an email when you are angry. Talking it out relieves stress instantly. Meditation, everybody knows, can take a full 3-hour session. What is meditation? Is position. You don't have to sit in cross-legged. If you have knee pain, if you have backache, there's no position required for meditation. It is done in your mind. You can sit comfortably in a chair and you can sit in a toilet on a commode and meditate. Nobody's going to stop you. Focus. Prerequisites are nothing. I don't want some agarbatti. I don't want a red light. I don't want flowers. I don't want anything. I just need to be comfortable in a position, close my eyes and control my thoughts. Method is breathing and imagery. I am not going in time, details of that because time is short. Control your anger. Know yourself. People who get angry very often, no, when you tell them, no, I don't get angry here, but these people irritate me so much, except that I get angry. Do important jobs now before they become urgent, because when we get angry, no, mostly we are missing out on something and we want to take it out on others. Don't criticize, condemn and complain because it will make you angry. Organize your mind and organize your desk. To-do list for 5 minutes every day. Every hour you decide what you want to do. Even ask stupid questions to avoid mistakes. Mistakes make others angry with you and that gives you stress. Never get angry with someone who has nothing to lose. Don't get angry with a rickshaw driver or a Uber driver. He has nothing to lose. This is all about my talk, and first time I have completed it in record time. One request, I have floated a new company called Amara Health, and we will be giving a lot of inputs on wellness and health management. If you are on Instagram, I would request you to scan this QR code and join us on Instagram to get latest updates. At least every day, 1 or 2 updates come on health and wellness, which may help you in your health or even telling your patients right things to do. Thank you very much.
Thank you, sir. Thank you very much for the mesmerizing talk. And the participants have understood very well because there is no any query. There are no questions. Now, ma'am, over to you. How will you treat such patients like diabetes, hypertension, ulcers, who got it from stress? Please give your.
Thank you, Dr. Satish. Thank you, Dr. Asrani, for this very, very elusive talk. And
Thank you.
Us a lot. So I will take some cases, and most important is from Dr. Asrani's talk. What we get is that
she's sharing her screen.
It is stress. That's me. So we have done so much on stress. So the whole thing is we are now going to discuss on what is the effect of stress that it has on us, right? We'll take 2 cases, but in detail, so that you understand what we are saying and that it is basically the coping mechanism that he talked about. And we will also see in the end of the case how the patient becomes so eustress, yes, which is our real aim in treating all these cases. So we'll take 2 cases, both are females. That doesn't mean that only females get stressed. No, it just happened that I wanted to take 2 ages. So one is 17, one is 47. So we have kind of different stresses. Okay. So here was the 17-year-old girl who came to us with severe social anxiety, fear of exams, and a severe stress. So now she's in the 12th grade. So the mother got quite worried. Her family background is father 62, He's a sailor, comes home twice a year for a month or two. Mother's 49 and a homemaker, has asthma. Brother 24 also having panic attack. He doesn't get up, then he gets up, then he doesn't go out, and so on and so forth. Sister is 19. So what is her main complaint? That she gets terribly anxious on seeing strangers. So she's stressed just thinking if somebody visits the home. She doesn't like people visiting home. She doesn't like going to school. And she shivers with this. Her attendance in school is 70%, less than 50%. She doesn't like to go to school at all. And she's not given an oral exam at all, ever. But now in the 12th, the mother can't, talk to the teachers and say she's good. And so please, let her be kind of. So she's always stressed. Fear of stress, fear of strangers. Going out to school, going by train, going by bus to the school is very stressful. There'd be crowd, there'd be people. And exams, very stressful. She can't focus. She wants to be alone in her room or on phones in her room with a few friends. She has only 4 friends with whom she goes out, and otherwise only a family. Constipation, again, we saw how everything is related, yes? So stools are only once a week, very hard, like stone, and pain while passing. So she is reasonable height, 161.3, 56 kilos, but very pale. Perspiration is profuse because of the anxiety, especially on the palm and the head. She has colic and nausea from anxiety. So everything is due to stress and anxiety, okay? So hunger she can't bear, she will faint. And thirst is 4 to 5 glasses, that's a little low. She loves food, craving for spices, chicken, lemonade, cheese, pickles. Doesn't like sweets. As we saw, desserts and stress are related. I don't know what it means when you don't like sweets. No desserts for her. So involuntary urine till the age of 8 years. So she was disturbed even earlier. We will see how and what happened. Sleep is disturbed and dreams are routine. Thermal, sun is lot of aggravation. Apart from perspiration, there is redness. She likes open air. She likes 20 degrees AC with fan on full speed, but likes to cover herself, and hot bath all 12 months. Now in Bombay, people somehow have hot bath, warm bath, always the hot and the chilly patient. So I don't give it too much credence. So she, at 14 years of age, she got her first period. And when she saw that blood, she fainted. So you can see that fear overrules all her mental state. Second cycle onwards, she was better. The periods are 6 to 7 days, 30 days quite normal, 3 to 4 pads, the mild pain, and during periods, slight more pain, better lying on back, better hot water. So usual, nothing major. Now her mother's obstetric history, full-term normal delivery. She was 4 kilos when she was born. Pregnancy was normal. She had a stress-free pregnancy. We always go to the mother's history because we find a lot of clues in that. But here we didn't find anything. Was happy without any fears. Lactation was for 2 years. And milestone, she said, mother said, were all normal. So here we have so far not got any clues as to what was happening. 2005, she was born, and she was born in UK, yeah? As father was studying there for his Navy. Then 2006, they came back to India. Now in UK, where there is not so much insects and so on and so forth, but even there she was scared of insects. And even if she sees ants, she would hide behind the mother, close the door and stay there. So fear started, we don't know the cause, okay? So sometimes the cause is not important, the effects are important, as was told to us earlier. Yeah. Once they were back in India, mother had a tough time handling her because she would cry. You know, they've just been in UK for such a long time. So people come to visit and she would cry seeing people, seeing crowd. In Mumbai, of course, where can you go without a crowd, right? So she won't allow the mother to sit with the guests if they came to visit. You know, they had just come back from UK, a lot of relatives come and say hello, hello. And she would follow sister everywhere. If mother had to go out, she would have to make sure that the sister sat with the patient. Only then she would stay. So she was always, always worried about people seeing her, thinking that she's not so good, and that they are talking about her. And she didn't like crowds at all. That's why she also didn't want to travel to school, plus not go to school. But she gets very angry if she's not understood, and then she throws things. So at home, you can see she's quite comfortable with the family, very sensitive, VP if she doesn't get something, and fear that people don't understand her. She has fear of lot of things. Okay, so everything gives her stress. As you see, you saw causes of stress. One was fear and anxiety. So darkness, insect we already know, blood we already know, crowd we know. So whenever she sees strangers and visits and she feels embarrassed, she never goes out to say hello to them. She thinks that people are staring at her as she's looking stupid. So poor confidence, because she doesn't go to school. People will talk about her when she goes sometime. And she thinks it is they're talking about her because she's stupid. Fear of injections, faints after taking one. So fainting is another one of her effects of all the stress. Here we saw she fainted even she got her first period. Anxiety on the stage, seeing strangers, and exam. So she hates going for exam. Written, sometimes she does. Oral, she can't. And she loves cats. She said they are cute and lovable. She is herself very stubborn in the house. So she gets angry and whenever contradicted. She likes being pampered. And because she was the father's favorite, she gets her way and all her work done. Okay. So yeah, the siblings will always tease her a bit. So but she'll cry and they will leave her be because she's the young. Anger or weeping, doesn't like consolation, likes to be alone, shares only with the family or her few friends, goes out with the family only, and she likes order and cleanliness a lot. So we felt she was more little mineral-like, not so much plant, likes order, ambitious in the sense she wants to do things but not go to school. Fear, she likes friend support, likes a group of 4, she hates crowds. So we took all these rubrics. Now I'm not going to go through all of them. So we took fear people of, crowd in, dark, bugs, approaching others, fear of exams, diarrhea also with exam stress, anxiety with coldness, with pain in the abdomen, obstinate, likes animals or cats, fastidious. She likes cheese. We took some of the cravings, aversion, ice, cold water, and we took the constipation where we said once a week. Warts and hairy. She was a little extra hair. So, what do you think will be the remedy? Ichajam. So, any kind of idea? Any chat box says anything, Dr. Satish?
Natramure.
Natramure. Okay, give us some reasons.
Dr. Gwalani said Natramure.
Give us some reasons. Some reason, somebody, whoever's written it, any reason?
Dr. Gwalani, Rajni Gwalani has written.
Okay, tell us why.
Rajni ma'am, please mention the reason. Brooding, aggravation, consolation.
Okay.
Dr. Anita mentions opium because of bad effects of fear.
Okay. But we don't know what the fear was, right? She just had fear of insect, but that was her trait. We don't know if something happened and she was too small for something to happen.
Then calcarea, Dr. Wahida, lot of fears.
Lot of fears. Okay. Very good. Very good. What else? Calcarea would have confusion, focus, all that is there. But her milestones are all normal. You must think, okay? Her milestones were all normal. She
Dr.
liked
Rajni
the
ma'am,
family a lot.
Dr. Rajni ma'am changed now to natrum carb.
Oh, why? She's not really chilly or so on and so forth. Yeah. She likes the AC. She likes open air. Carb is little more depressed, right? Little more down. And natrum, we would, I'm not saying it rules out, but we would say something about sun, something about salt, something about being affected, something about emotions, something about disappointment. All that we are not seeing as such, yeah? Okay,
Hates, because of hate strangers, she has mentioned natrum carb.
okay. Okay, but there are strangers is one part, right? So many other things. How come one has not thought of the biggest remedy for fears? One has not thought of remedies for exams. She didn't go for oral exams at all, and she would be stressed for going for exams. So I'm very happy with all these responses. You are very active and participative audience. That's very nice. So now we took all those rubrics, right? Let us see what comes out. So here is the working. So here phosphorus comes high, pulsatilla comes high, carcinosin comes the highest, natramure comes there, fourth, fifth. So whatever we've done, calcarea comes also same 24. So yeah, we've done all these. But if you see here, carcinosin is covering almost every rubric, including fears, crowd, dark, dogs, insects, approaching others, anxiety with fear, fear of examination. Then you have pain abdomen with anxiety. You have children affection, obstinate, headstrong, very marked. Yeah? Travel likes, again, carcinosin covers. Then love animals for, that also carcinosin covers. Fastidious, too much. Cleanliness, too much. Then love nature for. Check everything, she must. She is sympathetic, okay? Dreams of robbers. Once there was a robber, after that she got dreams of robbers and she would check. Aversion to sweets. So very few remedies cover that. Like natrum doesn't cover aversion to sweets, and calcarea also. Then she likes condiments, carcinosin covers. Sour acid doesn't cover. Is cheese, it covers. Reproaches, ailments from it covers. Constipation, it covers. Natramure would also cover, but calcarea, would be happy with constipation. And calcarea has soft stools. Here are hard stools. So natrum would come in. Warts and condyloma and hairy. Okay. So you can see 27 rubrics And the next one is 24, 26, so on and so forth. Pulsatilla, we already said it is not no plant kingdom, not that carcinosis mineral, but it was a very surprising repertory which came up. Okay, so with this, I didn't think there was anything which which kind of ruled out carcinosin. So that is what we gave. Any questions on that?
No, ma'am. No, ma'am. In fact, the argentum natrium and stramonium have been mentioned.
Yeah, but argentum, so we took again, just because it was not so, in my mind so much, that I took some of the mentals separately: fear, crowd, dark, bugs, approaching others, and anthrophobia. And again, carcinosin covers all five, but so does another remedy which has so many fears, which is stramonium. So very few remedies: carcinosin, lyco, phosphorus, and stramonium. But here she didn't like people so much, and so phosphorus was ruled out. We gave her carcinosin. And what do you expect will happen? It will work, it will not work. Sometimes it happens that a remedy selected doesn't work, right? Anything in the chat box?
No, ma'am.
So here, follow up. She was better 3 marks.
Dr. Vibha has mentioned she will start going to school.
Ah, very good. So she went, exam she went for. And she did good. No headache, no stomach pain. Periods was 16-1-4-30. All fears were better except the insects. And for exams, few second chair anticipation. Now we don't expect so far such good result, right? Within just a short time to get such a good result was really heartening. But because she had still some stomach pain and some insects fear, and we thought we'll repeat it one more time. So once in the month, we repeated carcinosin. By 11-3, exams were over. By 8-2, she did well in the board exam. There was no anxiety, no stress. She's now preparing for CET. Periods were okay. Pain was still level 8. So again, we repeated carcinosin. And we just, for like that, I told you exam, sometimes we are fixed, so we gave gelsemium because it was CET. And she may be stressed, so we gave her SOS, but she never used it, okay? So that was a case of stress with fears in a child where we didn't know the cause because the fear started right at 1 year without any pregnancy history. So, which we always ask for. And normally you would get something, but here she said she was happy having her third child in England. So, yeah, we had no reason to not believe her. Yeah, anything you want to say in the chat box, Satish?
No, no, ma'am. No. No message.
So, this is a thing to learn, that we have to do always a three-legged stool. Think of the patient, think of the repertory, think of, what analysis you have made. So you have you have your materia medica, you have the repertory, and you have your understanding. Okay. So the repertory led us to a remedy, and we couldn't find anything which contradicted it as such. And for the others, like natrum or calcarea, we also didn't get anything specific. Like calcarea, I'm not saying that it always has to be there, but you would get 1 milestone or 2 milestones a little delayed, a little bit more, slow child. Here the child was not slow, it was all the fears and the thing. And natrum, you would have something. I'm not saying that sun and salt has to be there, but it adds strength to it. And here she didn't, she was good. It was, uh, mineral kingdom, but third row or the fourth row. And we were not finding anything specific. So, and carcinosin did cover almost every rubric. So we had no reason to doubt carcinosin. And if you read carcinosin, it really fits into the case. Yes. So we'll move on to our next case, which is a little more detailed. So here she was 44 when she came to us in 21. Today she's 47. So mainly for stress and other complaints like diabetes since 2012, HbA1c was 6.9, hypertension on tablet, now it is 120/80, but that is on the medication. Here we are going to not go through all the complaints because there are too many complaints, but I want you to see how many complaints are there. Periods were all right, 129. Bleeding also was all right, but it continued a little heavy on the 4th, 5th day. She had a lot of pains before and better flow. Dysmenorrhea a lot, 3 marks, better bending double, better hot. Constant urging to defecate, the stools are scanty. She sat on the toilet full day. This is during her periods. Sometimes she sat so long. She said, I felt as if I sat on the thing for full day and still I wouldn't defecate. After marriage, it was better 10% and better 50% after child. She had this feeling everything will come out. From menarche, she had this feeling everything will come out of the vagina. And till today, she has this. So otherwise, constipation, so she had brooding, very irritable, anger. And we'll see why she has all of that, okay? She also had IBS. It was diagnosed only in 2019. So she had 2010 duodenal ulcer. So we can see that this patient has had a history of many complaints very early in life. So there has to be a lot of stress factor. Okay. A lot of GI attack, also breathless and asthma, throat as if a ring is around it. Yeah. Nausea every day. Okay, she had lots of complaints. And she is very sad about it. Since 1990, asthma 3 times a year. Then itching, lacrimation is there every day with dust and watery discharge or difficulty breathing, must lie down. All this I'm not going to tell you because I want to go to the life story. So sleep is very disturbed, 3 to 4. Dreams, office, relative boss, harassing us sexually. So we can see that there's a lot of problem, anxious dreams, breathlessness, choking. So we can see there is a lot of stress and we need to explore a lot of our life too. So that is what we will focus. So 1977, she was born, eldest among 5 sisters. Father wanted a boy right from beginning. She was not happy even with the first daughter, though she was the eldest. And after that, there were 5 and no boys. So too many restrictions on them. Mother very strict, but overall father was doing well. So standard of living was good. Clothes, food, schooling, all that. The father loved his brother's son more than us. Kept him home with us for his education and everything. 1985, when patient was 8 years old, the same cousin who was a little bit older raped her for months. And patient couldn't do anything about it. He couldn't tell. She was very fearful. So we can see how early everything started. Once the aunt came home for a vacation, Bua, she saw what was happening and she told everyone, and the boy was sent back to his house. But still, no one told him anything, just sent him back. In fact, my father helped him later on also to start his own business, get him married, his children also born in my house. So she can see the anger that nothing was done for her. So it's all suppressed, yes? Nobody cared so much for her that she could vent out to anyone. But this incident affected me a lot and became a quiet and lonely. In 91, I got TB. Since my friend's mother was a nurse, I was sent to her house so that treatment and testing could be done easily. There, my friend's grandfather raped me many times. I again did not understand what was happening, and every time would just feel disgusted and wait for it all to get over. So you can see where all her problems lie. Only later, when I started reading some books, I realized what had happened to me. And then I started getting vertigo without any cause, and nothing helped. And finally, she took psychiatric treatment and was better. Since my 12th standard, I started getting marriage proposals, and my father's choice was a rich businessman. I refused to marry. Father and uncles all got angry with me. Then I finally said, okay, I can't bear all this anger. So 96, she got married. Husband didn't turn out to be as well off as he said he was. Though today he is earning well, but that time it was quite a shock for her. His house was like near a nala, nala, na? Like how you have in the slums, water flows, dirty water flows down. His eating habits, his way of talking, everything, financial condition not good. Everything was a shock to me because she had come from a well-to-do family. He's short-tempered, dictatorial, doesn't allow me even to visit my sister's house. She's not happy, but she is stuck with him because I will not be able to manage, by which time she had a children very soon, 2 girls. So I stick to him. He's mostly out of town on work, only comes on weekends or once a month, so it is not so bad. But we still have frequent fights even in the short time that he is here. I'm now in relation with somebody else, which gives me some happiness. Yes, some little bit of happiness. Anger with trifles, with especially with husband. Then I bang doors if angry, once through a glass. But now I'm become better, don't cry so much, but still brood a lot, and lot of stress how my life is going. Husband with me, I never had a good relationship. He insults me in front of anyone and everyone. I feel very sad and feel that my father is responsible for all my problems. Hatred towards my husband and father. Physical affection, I don't like being touched by him or even by any adult. Even women, I don't like being touched. Fear of darkness, ghosts, death, choking, cancer, giant, fear of planes. And worry is 3 marks about finances and elder daughter's marriage. Past history, there was a robbery in the house. Then I'd be very cautious, search the entire house and double check the house. Company I do not like. I like to be alone. I like reading murder mysteries and thrillers. Tight clothes aggravate mentally and physically. And after coming home from job, I like to be in my room, not even with the children. So that much of a loner, which right from childhood. Your kingdom, definitely animal. She has been a prey all her life from childhood. Right? You have the prey, you have the predator. So here she was the prey, and therefore we thought of animal. Though by suppressing, she tried to make the best of it till she understood about rape. Then she developed severe vertigo, took psychiatric, abused and raped over and over again. Yeah. And even now, husband is kind of abused.
Rajni ma'am has mentioned sepia even before it works.
Okay. Very good. She had so many fears, brooding, illness from reproach, insults, resentment, and a continuous stress. So many people tried to exploit her. She felt despoiled, almost like a prostitute, hatred of husband and father who put her in this position from which there is no escape.
Dr. Harshad has mentioned staphysagria.
Okay, very good. So because she's not venting out so much, and sometimes she banged doors and so
Ambragracia, Dr. Wahida.
okay. Ambragracia has got clinging, right? And taphysagria has lot of suppression. Taphysagria also belongs to the Ranunculaceae family, right?
Yes, ma'am.
Yeah. So here you can say that she's Ranunculaceae in the first column, subclass 1, but you can say that she was little knave, but that was at 8 years, you don't expect, 8, 11, 13.
Lac felinum, lac felinum.
Lac felinum. Why lac felinum?
Lachesis.
Lachesis.
Dr. Rama, why lac felinum placement?
Yeah. Why lachesis?
Sepia again.
Sepia again. Okay.
Delusion prostitute. Dr. Rama mentioned delusion prostitute. Hence lac felinum.
Yeah, that's a good connection. So here we took wronged, guilt, insulted, abused, and animal we said very high, especially mammal, because it's inferior, superior, dependent versus independent, nutrition lack of. So we came to one other family called cat. Mammals between mother and child is tenuous. Things can go wrong. She feels she suffered wrong. Suppression of emotions to stay with the group. That is mammals. Lack of security, insecure. And they have a fixed survival strategy. This patient has suppressing emotions as a strategy. So we took, that is our thinking. We took repertory. As somebody said, sepia came the highest. It covers almost everything here. Lachesis also covers quite a lot. So does calcarea, so does carcinosin, tarantula. So what are we going to do? And lac felinum is here. So it covers 6 rubrics. So it covers, let us see what rubrics lac felinum covers. Fear of high places, then abuse, ailments from sexual abuse, then hatred of persons, reserved, intolerance of tight clothing. So it covers quite important rubric. So yes, we are thinking of animal kingdom, but sepia only aversion to sex, but I think anybody who has so much abuse would have naturally aversion to sex. And sepia is such a well-proved remedy, it has to come about, right? And the antisocial, all that would make you think of sepia. Lachesis, of course, she doesn't talk so much, so I would more, yeah, some tight clothing, this and that would be there. But so Then that was physical. Next, mentals were repertorized and only the animal group was taken. So here, again, calcareous sepia, what we took is all the fears, all the ghosts, all the robbers, high places, abuse, and alone ameliorates, company aversion to, so on and so forth, we took. Again, as we were thinking, so calcareous sepia cover 14 rubrics. Over there it was 28 and the gap was a lot. Here with lac selinum, it was fears were there, abuse were there, sexual abuse were there, hatred was there, reserve was there, and independence. So the remedy we chose was black felinum, the cat. So the cat is aloof. It is fastidious, constantly licks, independent, touch avoids, except at her will when there is purring. So she had a new companion where she probably liked the touch, and everyone else she avoids. Suppress, keeps her dignity. Loner, avoids company. Independent, will do job and continue it. Responsibility takes, but worries. Humiliated, embarrassed. Okay, we can do her follow-up. And then if you still want, we can do more of, I have lots of more data on lac felinum. So here, we'll first do the follow-up. 27/5/21. All this we said. Lac felinum 200 was given. By 18/6, her pain was better, earth to stool better by 60%. It was continued because everything was still only 46. He said no attack in these 3 weeks past. Asthma. By 4/8, she said periods were all right. No pain. Could do everything with ease. Earth to stool not there, so could go to work without any worry. Flow for 3 days. Menses no irritability or crying. Asthma settled. Distension better, 70%. Constipation better, 70%. Spasms of throat, 80%. Okay. So lac felinum, this was 2 months later, right? We saw in June. 2 months later, we repeated because there were many dreams still. So overall, she did well. I want to tell you the follow-up of today morning. Patient called on her own today. We didn't ask. She said, I'm 47 years old. After 47 years, I'm out of all my problems. I live my life as I want. I wear what I want. I go out when I want. All the stress is out and I have no words for thank you.
Ma'am, there's a request. Please differentiate between lac felinum and caninum.
Yes, I will. So lac caninum wants to please everybody. So this patient doesn't want to please anybody, not even her own children. She doesn't want to please anyone, right? She just doesn't show her anger and keeps it suppressed. So lac caninum and felinum are very different. So we can do more. We still have some 5-10 minutes, right? Dr. Satish?
It's 8:30.
Okay, so do you want to do more, people? Okay, let's do a little bit more, okay? I can stop anytime. Okay. A first impression of a cat is dignity, loyalty, grace, power. No catwalk, you call catwalk. No, models are called cat, walking on the catwalk. Precision, great leaping ability, acrobatic, walk very precise. Unique ability to survive fall from high places and safety ground themselves. Very high ability to accuracy. Survive high jumps. She has fallen from such high places, right? She has still survived. Strong sense of independence. Self-sufficient, doesn't like to be stroked.
Ma'am, there's a request from Dr. Anita. Some common medicine for stress.
Okay.
Common remedies for stress.
My God. I think that we will not do because the commonest medicines are everything in the materia medica. So we, if you still want to do it, it is argentum will be the first one, tremonium will be the second, with lot of fears and anxiety. Lot of the polycrest, all the polycrests will come. So I don't think there is any remedy in the materia medica which will not come for stress. That's why I didn't choose to do, I chose only to do cases. You still want me to do laxalinum, or you want me to do some of the remedies?
Ma'am, Lexaninum.
Okay. So you love me, then you pet me. So you pet me and love me, then I must be good. So want that feeling from somebody else. Needs family, yet he wants to be free. Chooses the master. Lac caninum doesn't choose the master. Whoever's the master, he becomes obedient and loves. Chooses to be domesticated, not that. Lac caninum is always domesticated. Can't be bullied. Would leave their owner if treated badly. Lac caninum would stay. Can't take abuse, revolts. Can't tolerate intimidation, will not submit to maltreatment. Even to her husband, she did bang doors and say no. Voices their displeasure. Need money and luxury, so prostitution. There is a lot of lac felinum which is, in prostitutes, and that feeling of being a prostitute. Lac caninum can submit and bear all abuses because dependent. Cats choose to accept abuse. 40. Puss in Boots. Fighting is cat quality.
Ma'am, there's a request. Acute cases or acute effects of stress. How to deal with it.
Okay. So you have to have, for example, okay, I will do a case of a girl who's in London, and she has this tremendous anxiety about exams. Okay. So she can't go, she can't bear to do the exam. And often she goes over there and she has to go out and, be apparently in UK or London, they think this is a common complaint. Many children have it, and they don't give much credence or treatment. They just say, okay, go out and come back when you're all right, which I found very strange because, exams is not a thing where you can, afford to miss some time, but they have different standards. So this girl, she, every time she would, tremendous anxiety, tremendous stress, she would sometimes faint. And then, so we took all the rubrics for that, and we gave her, what did we give her? Anybody can help me? Dr. Beba Fatima, what did we give her? We gave her stramonium. So, so much fear and so much stress about anxiety that we gave her stramonium. And with that, she could, sorry. We gave her pulsatil. And she goes out, she goes into the open air, and she feels a little bit better. So this time for her exam, which was an acute state, okay? This is an acute state where she went for her exam, and she just went out, she got the open air and she felt better, and she came back and she took a dose of pulsatilla and she came back and she could give her exam. And the second time she didn't even need the pulsatilla, in the sense she needed, because I had given her tech to her, and she took that and she felt she was better. And now she's been on Seclec for a few days. She did all her exams, and so that was managing acute. Then we had sorry,
2 more queries.
Yeah.
Cats choose to accept abuse. Please explain.
What, say that again?
Cats choose to accept abuse. Please explain.
So lac caninum, once it has a master, it will stick to the master. It will take all the abuse the master gives, but it will still love him. Next time he calls and says, come here, he will still come, though he was beaten just little bit time before. Whereas lac felinum will not accept. she will stay with the husband. Now this girl has stayed with the husband, but she has not accepted him or forgiven him. So she doesn't go whenever he calls. She stays in a room even when he comes and just fights sometimes. So fighting is a cat quality. But she's dependent on him because of the two girls. And so she stays. You understand the difference?
Yeah, ma'am. One more. What are the effects of fear in pregnancy? Effects on kids?
The fear in pregnancy will connect. Okay, so this particular girl, the same case, Black Felina, in her pregnancy, she went, she had to go on a court case to some Hyderabad or somewhere. And she had lot of fears because that opposite lawyer was, very dominating and abusive. So she had a lot of fears on that score. And so I will tell you the case of her daughter. Her daughter came to me for psoriasis, and she was a young girl, very small girl, and she felt, I've taken that case somewhere here, somewhere. She felt like a leopard because she was all over except her face everywhere. And in the bus, nobody would sit next to her. And it all stemmed from the mother's fear in pregnancy, so much fear. And this girl had a lot of fear, felt like a leper, felt like nobody loved her, felt, why was I born at all? And so much depression, so much fear, and so much real stress of going to school every day. Nobody will sit next to her. She'll sit alone. She had no friend, and so on, so forth, and lot of fear. And the mother's fear, that time, mother's case was not taken. Mother's fear and her fears led me to the fear group. Which is the fear group? Which is our fear group in our plant kingdom? Yeah? Anybody? Anything in the chat box?
No, ma'am. Stramonium.
Yeah. So Solanaceae is the group, the family of which has maximum fears, and Stramonium, yes, is one of them. And but here she felt like a leper and she was outcast, right? So we took, in that group, we took Mandragora, which is the leprosy miasm, and that girl came to us long ago, 10 years ago. And now we know that the mother is with us. So we know that she has had no recurrence, no attack. Yeah. So you understand about mother's fears in pregnancy have a lot of impact on the child. But here we had a case where there was no fear. Now maybe we need to explore more. Maybe the mother didn't say or whatever, but it can happen. So again, we are with, a doctor said we have to not be so much on the cause as to be on the effects, right? In this stress thing. And here we have seen also eustress, how today this girl, this lady, this 47-year-old lady is in eustress. She can do what she wants. And the husband also had learned not to, be so bad with her. And she got her daughter married last month, and she's very happy. She's very happy. And she, even with the husband, she doesn't fight so much. They still are kind of just about, but at least they are together and not fighting. Anything else?
No, ma'am.
So anal and air you can think about for a cat, okay? And you know that they have very, very particular, they will pee in the same place, they will poop in, far away.
There's a
And,
query.
yeah.
Fear of disease during COVID pandemic. Please explain.
Fear of disease in pandemic. That
During
was a
our-
common thing. That was a common thing, right?
Right.
Yeah. So we had everybody had the fear of getting it. So I don't think it was such a major thing. We had to take all the, and we've done a seminar, a webinar on the COVID, and we took, of course, the fears and all that. And our main remedy were camphor, because of the fears, because of all the complaints that we had. And we use that both as preventive and as curative. Even today, when we have a COVID case, we look at whether camphor is indicated and we give it.
The question was in respect to bad effects of that fear.
Uh,
COVID.
yes, so then you have to take all your fear remedies, which are phosphorus, ammonium, argentum, nitricum. Yeah. Today we had a case which you've been treating for some time, and really not helped her so much, I felt. And then she had this stomach problem all the time. She says, I have this pain. And today, somehow while talking, she said that, we have given her pulsatilla and other remedies. And today while talking, she said that, she's so clinging to her son, all the time worries about him. His follow-up is longer than hers also. He said, please get rid of this, I can't bear it. The boy is 32 years old. It's not a small boy. And she's all the time worried. So we used to take clinging remedies and all that. Today she said, I just love sweets, she said. And then she said that she's a music teacher. And we said, okay, sing a song. And she sang really well. So that artistic quality and the fear about herself and her children, her son, and constant fear about her health made us go to argentum nitrate. So sometimes just the artistic thing, we took the row 5, and we took the anxiety, and we took the clinging, and took the craving for sweets, and all her thing about, that she will not be well. My husband's so much better with your medicine. Why can't I also be better like him? So that kind of comparison we went.
Dr. Vaidya has asked to repeat the slide NL air.
Anal and air. This is anal and
Previous slide. Yeah, previous slide.
Tolerate peas, stubborn, constipation, fast stool, when you're not looking, haughtiness, very stubborn and subtle and sophisticated. Hidden element of being a queen.
It's almost
So
quarter to 9.
air is strength, air is jumping, air is elegance, sits arrogantly. Yeah, cat always sits arrogantly and confidently and self-assured. So keywords are formidable, intimidating, overpowering, desire. They don't like to be dominated. The aversion to being told. They speak and act with authority.
Please suggest book for animal groups of medicine.
What?
Animal groups. Book for animal medicine.
Yeah. What is?
Books, yeah, for
yeah. So it is, if first of all you have to come to animal, either be a prey or predator. Normally, then you have to decide which is a prey or predator. And this talk is not on that. We have a chart also of animal chart. One day I can take that for you. Yeah.
No, it's quarter to 9.
Yeah. Okay. So that is it about my territory, my this, my that, my image, very strong, and they don't like to be dominated.
Thank you, ma'am. Thank you very much.
Thank you so very much for listening. And you remember that we had phosphorus also coming high, because that selenium has phosphorus, sulfur, and mu, all are which are on the right side, and it shows a lot of independence. Okay.
And like is such a vast group of medicine that it will require one full day of the webinar seminar.
Yeah.
Thank you very much. May I request Praveen sir for the conclusion remarks? Praveen sir is there. Praveen sir.
Ravin sir, you want to say anything? Comments? Top share?
Praveen sir from Hyderabad, Telangana.
Anything? Dr. Asrani, any comments? Not your field.
No. Okay, ma'am.
Okay, thank you so very much for all of you for
Praveen sir has mentioned very informative. So please be vocal.
yeah.
Okay, ma'am. Thanks for wonderful session.
Thank you. Thank you. We did both the stress in general and we took stress in particular in cases and discussed whatever questions you had and answered them hopefully to your satisfaction. Yeah, anything?
No, ma'am.
Okay, so
Okay. Bye.
we are quite in time, little bit overshot because we did little more detail on lacfelinum. It's not there, it's not everything is available and it's not a very common remedy. So we thought we'll do a little more on that.
One last question for acute stress hypertension.
So acute
Quick one. For acute stress hypertension.
hypertension, you have to think immediately of veratrum, glonoin, gelsemium, depending on what it fits, and see what is the cause. Okay, so we have to see gelsemium will be due to fear, fright, stress. Veratrum, glonoin, you'll have sun. Veratrum, you'll have other symptoms. So these are the three remedies which come to the mind immediately, and you have to differentiate.
Okay, ma'am. Thank you, sir. Thank you, ma'am. Thank you, sir. Thank you, ma'am. Thank you very much.
Dr. Asrani, anything?
Thank you.
Okay, thank you so much for refreshing and making us all think of at least one thing we can remedy in ourselves after your talk. Okay.
Thank you.
Thank you. Thank you, Satish, very much for all the cooperation.
Thank you. Thank you.
Bye.
Bye.
Good night, everybody. Thank you for being there.